This country has designed this health insurance plans in such a way that every citizen or may not be citizen or a legal residence of this country should have the health insurance by law from 2008 onwards. Mr. Obama, he mandated the law that everyone should have the health insurance. Whoever doesn't have the health insurance, they will be paying the penalty whenever they are filing their tax returns. This is the law that everyone should have the health insurance. Some of you might be students in this country. Some of you may have already settled down. Some of you already have a green card or a citizenship. Maybe your green card under process by your health employer. So everyone situation is right now different totally. If you are a student, your fees are paying your health insurance to your university. By having that health insurance as a student, you might be getting 50% of premium paid by your fees, but the rest of the fees you might be paying from your own pocket or your parents might be paying for. If you are an employer, then you should have your own agency or you have a LLC or INCOP, and your employees might be having a health insurance. If you are an employee, then your employers are giving you options to buy the health insurance. They might be giving you various kind of the varieties of health insurance, maybe 2 or 3 options. Whenever you join the company, they are asking you that by law you should have the health insurance. You can choose from our plans or you can get your own health insurance. Some of you might be married and your spouse is getting the health insurance from their own employer. So everyone's situation might be different. You might be having a family and your employer is giving you coverage for you, your spouse, your children as well. So everyone's situation is different. I hope that your age group is between from 23 to 40 years group right now I am representing for. So of course nobody is older than that age, because the older you get, the different plans you get. After age 65, this country has designed the different plans for the health insurance. So I hope there is nobody age 65 or over. And also people who are disabled, permanently disabled, or may not be able to work, those people also having a different kind of the health insurance. So there are a lot of different kind of insurance as well. Now, by state, right now I am presenting only for New Jersey. However, health insurance plans are designed very much similar for all 50 states of United States. So let's go with one of this exclusive provider organization, that's EPO plans. Your employer may have offered you to choose one of the plan, that what kind of plan you should choose. That's a EPO plan or high deductible plans. Are we on the, excuse me, are we on the first slide?
We are now. Sorry about that.
Okay, no problem. So first slide is health insurance basics. It shows the basics of the health insurance. So there are HMO plan, PPO plans, and there are many other plans. The HMO plans and the PPO plans are very famous. Why it is famous? Because you have a liberty to choose your own providers, or you can go out of network providers. Now, everyone should know what is the PPO plan and what is a HMO plan means. HMO plan means that your provider, your doctor, your hospital, your specialist, or if you are going for any kind of the lab work, those we call it a providers. Those supposed to be in the network. Network, that means, say for example, Cigna is an insurance company. So Cigna should have the network with the same providers. You can make a choices for choosing your own provider. If you like Mr. X as your doctor, you wanted to make sure that Mr. X doctor is with Cigna's network. If Mr. X doctor is not in the network, that means you may have to choose the PPO plan. If you choose HMO plan and your doctor is not in network, and still you wanted to go with the same doctor, then you pay the entire cost of fees for that doctor from your own pocket. So that is the big difference between the HMO and PPO plans. Can I have the next slides, please? There is an exclusive provider organization, we call it EPO plan. So EPO plan, that means you choose your own provider, and as and when needed, you can go to those kind of the providers and you pay the copayment or the deductible fees, however your plan is designed for. There is a high deductible health insurance plans as well. That is high deductible. That means the more premium you pay and the higher deductible you may have, because the deductible are lower premium, compared to the traditional plans. That is the high deductible health insurance plans. There are also often paired with the high deductible savings accounts that you can pre-tax the contribution for the medical expenses. So that is little complicated, because it's a tax related, and you can save the taxes whenever you file your taxes at the end of the year or following year. This high deductible is designed to encourage cost conscious healthcare decisions. There are preventative care is usually covered without requiring the deductibles to meet. So what are the, you got to also understand what are the deductibles, what are the co-insurance, what are the co-payments. This might be in the beginning, might be very confusing and might be complicated for you to understand. So basically, whenever you have an auto insurance, you pay the premium every month, no matter what happened, but you got to pay the premium. Same thing here in health insurance, you pay a monthly premium, but you have to make the choices for your health insurance plans. So there are deductibles. What are the deductibles? What are the co-payments? Whenever you go to your health insurance provider, that means if you go to your doctor might be charging $100 fees. But you'll say, no, here is my ID card from my employer giving me the health insurance. Doctor will say, okay, let me put this everything in my system. They will put that everything in the system. They might charge you only $20 co-payment. That is called the co-payment, because $80 of $100 fees, doctor is getting paid from the insurance company. So that is the between the co-payment, you are paying only the $20, the partial fees. It depends how your health insurance has been designed. You might be paying $20 or maybe $50 out of your pocket. Can I have next slides, please? So this is, I think I already covered, right? What is the premium, deductibles, and the co-payment? Yes, let me, explain one more time. The premium that you got to pay every month, no matter what, you do not have to feel that any occurrence happens, because any occurrence happens that might be critical for you. So make sure that every month you make the payment of premium. Don't be late. If you pay the payment in the advance, the insurance company will credit you for the following month. If you pay more, they may return the premium or they will credit you for the following month. Next slide, please. Now, co-insurance. What is the co-insurance? The co-insurance is the cost sharing. Whenever anything happened to you, maybe you are hospitalized. So that means it's a claim. If you are staying in the hospital for a couple of days, and hospital may charge you a couple of $1,000. So by charging a couple of $1,000, of course, electronically, insurance companies are going to bill, the hospitals are going to bill to your insurance companies. They will communicate electronically on your behalf. After they will communicate, there are a lot of things are going on. How? Because they've got to get the authorization from the insurance company. As soon as they have the authorizations, they will say, okay, this $2,000 bill, now there is a deductible. They have to meet the deductible first. Then they will say, okay, now it's a co-insurance. What is a co-insurance? That means that might be 20% co-insurance you got to pay from your own pocket. That means if there is a $5,000 bill from the hospital, they will see your deductibles are met first, and then after the co-insurance backs you up. That means say for example, your deductibles are 4,000 and you already paid that 4,000. So remaining is $1,000. Insurance companies will communicate again on your behalf. After that, hospital will ask you, there is a $1,000 bill. Okay, you are not obliged to pay $1,000. You'll have to look at your policy first, that how much is your co-insurance. Co-insurance, that means in generally, you pay only 20% out of your pocket, but the 80% is paid by insurance company. So you might be end up paying only $200. That is all. Again, I'm just giving an example for throwing the different numbers of this amount, that how it works. Out of pocket maximum. So again, you'll have to look at your policy, because the policy has so many different things are written on it. Once again, deductibles, co-insurance, co-payments, premium, maximum out of pocket. So maximum out of pocket is maybe $10,000. That means as soon as you meet up $10,000 of all of your claims throughout the year, after that, you pay nothing, $0. That means If there is $100,000 bill from any provider, maybe a hospital, because you already beat maximum out of pocket $10,000, the $90,000 will be get paid from the insurance company to that hospital. That is how the entire insurance industry works. That is how it has been designed, because no member is obliged to pay 100% of their health insurance claims. Claims might be $200,000, $200,000 or $300,000, $500,000, because everyone claims are totally different. Somebody has to airlift it from one place to another place. It depends on their situation, their complication of health. If it's airlifted by helicopter, maybe cost over $1 million. You never know. But you have to make sure for this, you don't want to go with this kind of the situation, but hey, you never know. Outside weather and our health are 100% unpredictable. So you'll have to make sure that you are 100% insured very well from the insurance companies. You'll have to look at your plans. You have to go in the detail, read thoroughly all the languages. You can Google it. You just ask any questions to somebody who already have this kind of the insurance policies. You can contact me as well anytime. Can I have the next slides, please? Now there is enrollment. Now there are different kind of the enrollment for the health insurance. You are entering this country in the middle of the year. Yes, you are eligible to get the health insurance, maybe from your university, or if you are working, then from your employer. If you are not working and you are self-employed, still you have a liberty to get the health insurance from this industry. The enrollment in general begins from November 1 to December 31st. However, the window is closing on the 15th December, but there is always a grace period and extended time for some individuals. Generally, you'll have to select the plans. If you are working right now, your employer might have offered you the different health insurance plans to you. Maybe a one option, two option, three options. It depends how big your employer is. If there is only 10 employees in your company, they might give you the small package. You might be paying a higher premium. If you are surrounded with thousands of employees, your employer is very big, you may be paying a very little premium. With that little premium, you are 100% insured with your health insurance plans. But you'll have to make choices from your health insurance plans. They are giving you 1, 2, or 3 options. There is also special enrollment period. What are the special enrollment period? That means if you are not qualified between this period from November 1 to December 15th, and maybe you are a woman, you got pregnant, of course you are qualified maybe somewhere in March, April, May, June, any time of the year. You moved from New Jersey to California. You are qualified any time of the year to change your health insurance plans. If somebody died in the family, you are still qualified to change your health insurance plans. If there is a catastrophic situation, maybe a flood or a hurricane, something happened in your area, you could not able to pay the premium, or you had to move out from that geographical area, you are still qualified to change your health insurance plan. That is called the SEP. That's a special enrollment period. That's a life-changing event. That means these are the all, you become citizen, US citizen all of a sudden. Not all of a sudden, of course, by law. That means you still have a liberty and you are eligible to change your health insurance plan. I hope this living incarnation, that's not going to happen to anybody. But in exceptional cases, that might be you are eligible to get health insurance plans. These are the exceptional cases and the circumstances, the medical issues preventing you to change the health insurance plans, only those kind of the situation. There are financial helps is also available. You may qualify to get this financial helps depending on your location. It depends where you live, geographical area. Also the household sizes. That means you were single before, now you got married. Now you have a more burden financially. Then also you get a income tax help, that how much you may make each year. It depends on, there is a limits, different limits for the health insurance. There, you might have heard about the Obamacare and those kind of the plans, but that falling between people who are underprivileged. That means people who are under poverty level. I hope there is nobody in this group under poverty level, because if those kind of the situation happens, your state will help you to pay the monthly premium, or you may not pay a monthly premium, maybe a $0. It depends. There are all different amount are returned, that if your income is below 27,000 or $28,000 a year, you may be qualified to go with the Obamacare plans. Your state will help you to find the correct plan. You may not pay a single penny for your health insurance, but you make sure that you have a health insurance you are covered with. Because without health insurance, again, you may end up paying the penalties. The tax credit also you get. Sometime you may have a higher deductibles and higher monthly premium. So whenever you file your taxes, say for example, you are making $200,000 a year. Great. However, you are paying maybe $1,000 or $1,500 on your monthly health insurance premium. Following year, you show your accountant, hey, listen, I paid almost $15,000 towards my health insurance premium. Do I get financial help? I cannot afford to pay that much premium. Or can I get the tax deductible? Yes, you may qualify to get the tax deductions from your premium paying. It depends on your how much income do you make. You can also apply for some of your premium tax credit to your monthly insurance premium payment. The marketplace will send you a tax credit. So every year, the tax department will send you the form that from January to December, you were insured with your health insurance plan. Say, for example, in March, you had no health insurance, and that is not good, because you should have all 12 months continuation of health insurance. in any 1 month you missed by having not health insurance, you end up paying the penalties to the federal government. The marketplace will also send your tax credit directly to your insurance company. You will pay less each month. This is called a taking an advance payment of the premium tax credit. That is what I just explained to you. And also, if you use advance payment of your premium tax credit to lower your monthly premium payment, you will have to reconcile those tax credits when you file your federal income tax and following year using IRS form 8962. So this is the form IRS is going to send it to you from monthly that you have a health insurance. That means you will compare the amount, the premium tax credit you used during the tax year to lower premium, and also the amount of premium tax credit you will qualify for based on final annual income for that year on your tax returns. So you have to make sure that whenever you file your taxes, you take some advices from your accountant that what am I qualified for getting this financial help as well. Can I have next slide, please? Cost sharing and the reductions. That's a CSR. So what is it? People who qualified for premium tax credit and have household income between 138% and 250% of the federal poverty level also qualified for CSR. So I don't think that any one of you will qualify for this CSR, because as I'm assuming that people who are making money is migrated on the student visa or who are already started working on their H1 visa. So H1 visa has a one categories for their income that nobody is following under the poverty level. So I don't think any one of you will qualify for CSR.
Thank you, Parishbhai. Thank you for that. That was very, very helpful.
Sure, no problem.
I do have some
anybody
questions
has
on the
any
chat.
question, answers, please, I can answer.
I do have certain questions on the chat, Parishbhai. I'll go ahead and first ask that questions, and after that, if folks have more questions, and we can continue to ask.
Yeah.
First question I have is, if I'm traveling to India, does my insurance cover the expenses I incur in India?
So unless and until, yes, traveling to India, yes, it will cover you with your health insurance plans, but you have to make sure that you read your policy first, that how it's going to cover you. Because if you are going there to India for a short time, the only in emergency, your health insurance company will cover you. If you have a fever, if you have a cough, cold, then if you're running to your primary care doctor will say, okay, 10,000 rupees is a bill. No insurance company is going to reimburse you, because that is very normal thing that you can take care of yourself and you can pay by yourself. But if you fall somewhere, you have a fracture and you went to the hospital in emergency room, the hospital is going to bill you 200,000 rupees. Most of the insurance company will say that, okay, you pay upfront that 200,000 rupees from your own pocket, bring the whole receipts, original receipts back in this country whenever you come back, claim to your insurance company with original copies. Here insurance companies are going to verify with Indian hospitals. After verification, they will send you the reimbursements according to your they will deduct the deductibles, maybe a co-payments, and then after they reimburse you whatever the amount.
Okay. Next, thank you, Prashbhai. Next question I have is, does Obamacare cater only for American citizen, or is it applicable for students and H-1B visa holders also?
No, that one also apply for H1 visa. I don't think again, that anybody is on H1 visa will qualify for Obamacare because their income is about 65 or $55,000 a year. So, however,
from a visa status perspective, they can, but then it only depends on their income that they're earning. So even though H1B is can do it, but because their income is more than 65, most of the time, they may not qualify.
So there is the complications here. So for example, the H1 visa person got laid off. Okay. So they have some kind of the period of the time that they will have to find another employer. Say in 60 days time, they do not have another employer. For 30 days, another 30 days. So the prior employer is giving you an option. Okay, I'm giving you a layoff, but your health insurance will continue for 30 days or 60 days. That's a COBRA plan. The COBRA plan will cover you. So the COBRA plan, health insurance premium, 100% you pay out of your pocket. That means within that certain time, you'll have to find a new employer with a new health insurance plan, or you may continue with the COBRA plan, where the COBRA plan health insurance premium is too much high. You may be paying to your prior employer maybe $500 monthly premium. With the COBRA plan, you end up paying maybe $1,500 monthly premium. So that encourage you that you have to find a new employer with the new health insurance plans.
That makes sense. Next question I have is, do we get tax credit when we file our taxes on premium paid? If yes, what is the maximum limit?
Yes, you get it. What was your question again? The last sentence?
Do we get tax credit when we file our taxes on our premium paid? If yes, what is the maximum limit?
So there is nothing maximum because nobody's health insurance premium for individual maybe $2,000 or $2,500 maximum. So you don't get that. There is nothing like a highest amount on it, but most of the time, of course, you will get the tax credit. Yes, but again, you will have to talk to it. Depends because you are falling in between income between 60,000 to maybe $250,000 a year. So everyone's the income slabs are different. So accordingly, you'll get the tax credit.
I have three more questions, Pareshbhai.
Sure.
Would you recommend getting an insurance in India along with, if you already have an insurance here, like when we are traveling, based on your experience? Is it recommended to take a separate insurance in India?
I do not recommend because as soon as why you want to pay two insurance companies where you are only available in one country?
Nowadays, what is happening is a lot of people are, because it's work from home, a lot of people are traveling to India for a good duration of time, like 2-3 months. Like earlier, it was only 2 or 3 weeks, but nowadays a lot of people travel to India for 2-3 months. So I think their question is more on if they do fall sick in India and they have to go to hospital or doctor, is it better to have an India insurance, or US insurance will cover all, because it goes out of state, right? It goes out of state, right?
Right. I understand the question now. If you are, if you really want the Indian health insurance, keep the basic policy. where you have to end up paying very less monthly premium or yearly premium. Just a basic health insurance coverage, the cheapest, whichever is available, keep it for you. Yes, I will recommend that. Of course, if you are traveling a lot, maybe in 12 months time, you are 6 months here and you are 6 months there, then you should have the Indian health insurance. Yes, but keep only basic policy where you pay very little from your own pocket.
Right. Do you have any suggestion on using healthcare savings account, HSA?
HSA is, of course, if you are thinking, first of all, that you will be permanent here, okay, or next 4 5 years you will be here, then of course, yes, you should have the HSA savings account. That is really helpful. But it's workable only in the long term, because some of the HSA is rolling over for the following year, and some of them are you use it or you lose it every year. So you'll have to find first that how your HSA policy is designed for, because every state, every insurance company is giving different kind of HSA options.
Next question is, if someone doesn't have a health insurance plan, do they have to pay any fines? Like, the obvious is, if you fall sick, then you will not get the insurance. Like, you'll have to pay everything out of your pocket. But are there any fines that the government charge if they don't have an insurance?
Yes, whenever you file your taxes, a government is charging you penalties for that.
Okay.
That's why I said, you should have the all 12 months continuation of the health insurance policies. No matter what, if you are a student, if you are an employee, if you are a self-employee, you are a married, you are not married, it doesn't matter. You are a man, you are a woman, it doesn't matter. You should have you have a children, yes, they also should have under your policy that everyone, every single person should have the health insurance. That's a law.
I have two more questions and then I'll
Sure.
close. A lot of
No
students
problem.
buy insurance in India that cover international travel and is usually cheaper than buying an insurance in India. Is it better to buy the insurance here or an Indian insurance is good enough? I think this is specifically for the students who are coming into the country for the first couple of years.
So no matter what, actually, if you are a student, your university is giving you a health insurance, just like, they are giving you education, tuition fees they are charging you, the partially they are charging you a health insurance premium. And you cannot void it out. It's by law. They have to give it to you, and by law, you have to buy it from them. It's on your fees. There is no way you can opt out health insurance.
Got it. Last question. There are many universities that do not allow their students to opt for an insurance that has a lower premium or deductible and force students to opt for the plans that they offer. In such instances, are there any laws wherein we as a student can challenge the university and opt for the plan of our choice?
Now that is too legal. Actually, I cannot answer that. Because every university has a different law, and every state are different as well. If you wanted to challenge, then you had to talk to the administrator in your university. I cannot answer that. Sorry about that.
Those are all the questions I had on the chat. Is
Sure.
there any other question that folks want to ask? And at this point of time, I'll just folks unmute and ask that question.
No, feel free to give me a call if you want anything one-on-one. Share my contact number to every member of this group. I'm available Eastern time. I work, of course, from 9 o'clock in the morning to 7 8 o'clock in the evening. I'm totally freelance, independent health insurance agent. I have a multiple health insurance licenses. Just you said before, life insurance, health insurance, group life, group health, then individual like auto insurance, homeowner insurance policies, workers' comp, general liability. Some of you might be having their own LLC or incorporated small company. I can write general liability policies for you as well. No matter what state you are in here in this country, I can write anywhere, but of course, feel free to call me up or email me any question if you have. I'll be happy if I can answer very well to satisfy you, but make sure whenever you buy, maybe not from me, that's fine, but any kind of the insurance policy you buy from anybody, make sure that somebody is licensed agent. Do not, get the wrong advices from unlicensed person. There are a lot of fraudulent going on, around the country. So make sure that you are talking to a very professional person who are experienced and licensed as well.
Paresh bhai, there is definitely a couple of more questions as Manan, who here specifically wants to get an understanding of the health plans that United offers. I'm going to request everyone that we will be sharing Paresh bhai's contact details after the call through email. I think Bhavin has already put the phone number on the chat, but we'll send it over email also.
Okay.
So feel free to reach out to Paresh bhai in person, and he will be happy to help.
Yeah.
Bhavin, do you have any closing words?
Yeah. Thank you, Paresh bhai. Thank you so much for your time.
Sure.
I really appreciate you helping our community members be aware of what are the insurance plans and how to select an insurance plan, and help us with a brief introduction and Q&A. I think Q&A, like a lot of people, I see there are 3 more questions, but yeah, I see people are more curious to know about the benefits of the health insurance and how they can take most benefit out of it. So definitely we also have some conversations. We have our what beyond this meeting, right? We always have questions related to health insurance, be it a student or a professional. And sometimes we cannot redirect them. Like they ask us which policy is better. So if someone has got benefited, they do suggest. But this is my ask to you, right? And you can decide, like, can we redirect or can we share your contact details whenever they have any questions so that you can help?
Yes, definitely. Yes, you can share my contact to everyone in your group, and I'll be happy to advise anybody. I'll have to review first, of course, that how somebody is offered by that employer with different options and what they should choose. Because you might be new here, you might be single, you might be married, you may have a children, and you are, in between, cannot make any decision how to make the choices for this health insurance. I'm here always for you. I will, give you the correct advice. Of course, end of the day, choice is yours. But I will give you the choices and make you understand first of all that what kind of the choice you should make. So in the future, because everyone's health situation is also different. Maybe somebody has genetically from their parents, grandparents, any kind of the diabetes or heart issues. The young person doesn't know what should I do. Of course, you take care of yourself first of all. You diet, uh, and of course you do exercise. But those are the basics. Again, your health is totally unpredictable. You never know what is going to happen next to you. I'm not, threatening to anyone, but I want each one of you should have the correct health insurance plan. So in the future, you do not end up paying a lot of money from your own pocket, because we earn, after so much efforts, some money, and we are obliged to give back to this community. And then after, we will take care of ourselves. So our money is having some value for ourselves. and how to use that is more important. So feel free to share my phone number, my email addresses, and I will be happy to advise anyone. No problem to me.
Thank you so much, Pareshwar. Thank you from my side, and thank you from everyone on the chat. I again thank everyone for taking Saturday and joining this meeting. Jai Jinendra, and have a good rest of the day.
All right. Thank you very much for having me, and I wish every group member all the best for everything. Jai Jinendra.
Thank you.
Thank you.